afternoon, everyone, and thank you for participating in today's webinar on COVID-19. This is a town hall meeting for child care providers. My name is Dr. Beverly Lynn, and I'm CEO of Programs for Parents. I'm excited to lead this event, but this could not have been possible without the vision of Lisa Asari, Assistant Commissioner in the Department of Health, and with the help of our partners at the Partnership for Maternal and Child Health of Northern New Jersey. So thank you to the both of you. Just 20 months ago, we never thought that our leadership abilities would be tested beyond our imagination. In the beginning of the pandemic, we were all looking for guidance, but things were changing so quickly. Many of you did not know how to respond or what to do. We were in the same place as programs all over the country, a place of uncertainty, fear, and concern. Many of you tried to remain open as long as you could to ensure that parents had somewhere to take their children. As businesses shut down, parents transitioned to remote work from home, and schools closed, it became evident that at some point, childcare centers would also have to follow suit. Governor Phil Murphy signed Executive Order 110, directing all childcare centers in New Jersey to certify by Friday, March 27, 2020, that they would solely serve as emergency childcare centers for the children of essential workers. Childcare centers that did not certify that they could exclusively care for children of essential workers were required to close by Wednesday, April 1st. For many of you, that was a sigh of relief. But to our amazement, many of you did not hesitate. You decided that you should step up to help those who are putting their lives on the line for us and our community. You are our heroes. And then for several months thereafter, you adapted to new requirements, new procedures, new policies, all designed to keep children and staff safe. Then on Monday, June 15th, childcare centers were allowed to reopen as long as they complied with state safety restrictions. This occurred as the governor gradually reopened the state as the outbreak here in New Jersey continued to slow. In Essex, there were many centers that did not reopen right away. In fact, there were many that did not reopen until September. Again, concerned about the safety of staff and children. You know, you've been asked to be innovative, but innovative leadership involves more than just figuring out which new ideas or technologies to include in your program. It also involves determining which old ways of doing things need to be left behind in order for you to thrive in the present moment. This has never been more evident than right now. As our post-COVID world emerges, and of course, we're hoping that that continues to change for the better, many of us are finding out that the changes that we once thought were temporary are here to stay, and that many of the systems, processes, revenue models, and leadership styles that used to be so normal to us were actually quite flawed in this new environment. So we are left with two choices. We can keep hoping that things will return to what we used to call normal, or we can innovate in and around how we do things now. Today's conversation is not just about vaccines and testing. It's about survival, resilience, safety, and good health. It's about saving lives, including yours and mine, all the children you serve, the staff you support, and those that support you, and of course, the families. So this comes from the heart. Thank you for deciding to stay as childcare providers, early childhood education professionals, and caregivers. You've pulled up your bootstraps and decided that children are worth it, that parents and families need you, and our future is in your hands. You are the survivors. So without further ado, I want to introduce our panelists for today, and they will present in this order. Brian Ross, Esquire, who is the Assistant Commissioner for Legal and Regulatory and Legislative Affairs in the Department of Children and Families. Dr. Helen Cass, who is a pediatrician and epidemiologist at St. Joseph's Hospital. And last but not least, Dr. Soramar Rivera Nunez, who is the Assistant Professor, of Epidemiology in the Department of Biostatistics and Epidemiology at Rutgers School of Public Health. That was a mouthful. In any event, I am delighted and very grateful that all three of them have agreed to participate in today's panel. And I will say that if you have questions as the presentations are being made, please put them in Q&A. We got so many questions in advance, and I know some of them have been incorporated into their presentation, and then others we will answer when the presentations are complete. So questions, please put them in the Q&A. Thank you so much. And I'd like to bring on Brian Ross at this time.
Well, thank you, Dr. Lynn. I really appreciate that. And thank you, everybody, for joining us today. It's great to see so many people out there. And I'm rightfully the opening act for a much more interesting panel, so I won't take up too much time here. But I did want to kind of echo something that Dr. Lynn just said there about the really just the way that childcare in New Jersey really has stepped up over the course of the last 20 months. 21 months at this point. We're losing a little bit of count, but really not to put too fine a point on it, but there in March of 2020, we when the order went out that we needed to identify centers to provide care for emergency personnel, we gave the entire industry a weekend to decide if they were going to step up and provide those services. And really to our surprise, and I'll admit to you, I think we were even surprised at the rate that more than 600 centers stepped up immediately, again, over the course of less than 48 hours, and said they wanted to remain open, that they were willing to implement all kinds of really rigorous safeguards to ensure the safety of their staff and children in care. And at that point, those centers, very, very few of them have closed. Very few centers across the state have closed. We really have seen in New Jersey just a level of childcare support and industriousness and into innovation that has really been at odds with a lot of the experts nationwide had said was really going to be the case. There were very dire predictions at the start of the pandemic that we would be losing 40% of the industry, that we would be having emergency rooms closed because they couldn't staff because childcare shortages, that fire departments couldn't staff because their kids couldn't be cared for. We've not seen that. We have seen closures across the state. We've seen at this point roughly 300 centers out of what was originally 4,100 pre-pandemic have closed permanently. We're very sorry to see that. That is more than we would see in a typical year, but a very, very far cry from some of the dire predictions we were seeing at the outset, and really a lot better than other states have fared. So the industry in New Jersey is, as much as it can be in 2021, in a very healthy place. We're at least prepared for some resurgence and in a better place than a lot of our colleagues in other states are. So as far as the topic of the day goes, we are at this point exactly 1 month into the governor's mandate for vaccination and testing for childcare staff. And once again, we are very, very pleased with the way that the childcare workforce in the state has really stepped up, seen the necessity of what's being asked of them, and move forward to either become vaccinated or comply with those testing requirements. We have not seen the mass exodus from the workforce that some of the more pessimistic critics of the decision may have predicted. Particularly in those counties I would say statewide, we're in very good shape, but particularly in those counties surrounding the New York metro area, we've seen compliance levels really in the 80s and 90s in percentages. Many centers reporting they've got 100% compliance with the vaccine requirement. We're very happy to hear that and see that. And once again, as has been the case for the entirety of this unfortunate episode of the last 2 years, childcare has really exceeded expectations, has really stepped up to do what needs to be done to ensure the safety of the children they're caring for. And we are, as always, particularly glad to hear that and very happy to see that. And I know there are a lot of questions we're getting into about some of the specifics, but before I turn it over to the other members of the panel, I just want to say again, thank you. I think Dr. Lynn used the word heroic, and I think that's an absolutely appropriate word. What you all have done as providers has really, really been essential to getting the rest of the state through this crisis, and we really can't thank you enough. So with that, I know we'll be taking questions here shortly, but I wanted to turn it over to my my fellow panelists then.
Thank you so much for this wonderful opportunity, not only to present with my esteemed colleagues and panelists, but to have this opportunity to speak to educators and childcare providers. I would like to re-echo what has been said. You are indeed the true hero of this pandemic in the way that you have demonstrated adaptability and flexibility. And it is because of people like you that I'm here today, and people like me were able to do what we do in our battle against COVID. So please, can you enable my screen share so I can share my slides? So I am a clinician and I am an infectious disease epidemiologist. So today I thought that I would like to just take us back memory lane to understand the science behind prevention and why we do what we do. Since the pandemic started last year, there are still a lot of unknowns, but there are so many things we know. We are more than ready to tackle whatever comes in the future, just because we know a lot about how the virus behaves and what to do in terms of prevention. I would like to share my screen. So COVID-19 pandemic is still ongoing. We would have wished that it would have stopped by now, but we are still seeing a lot of cases, and we are kind of in our 5th surge already. And this tells us that just like we had heard before, we all have to just put things in place and embrace methods of prevention so that to maximize the benefits of prevention for everyone, children and adults alike. I'm going to touch briefly on Omicron, but I'm going to be available to answer any questions they are about the new variant. And the main goal of my talk is that prevention works. Vaccine as a key tool for public health works. And I hope that everyone, especially those who have not made that decision to take the vaccine, will do so. So one of the biggest questions I get asked all the time is, we are tired of this. When will this end? Well, it's kind of a race to immunity. When we have more than enough people immune to the virus, I'll talk about that, then the pandemic will end. And when I say end, I'm not saying that we are totally going to eliminate COVID. What I'm saying is that COVID can become one of those viruses that just cause, common cold, and then we get over it and then we'll be on our way, rather than what it continues to do, putting people in the hospitals, in critical care units, and taking lives. So I'm going to touch on this very briefly because my esteemed colleague is going to talk more about the epidemiologic aspect. So since COVID started, it has affected every race, every gender, but we also know that Black and brown people and minorities have taken a big hit in COVID as far as the case rate is concerned, hospitalization rate, and those people who are likely to die from the disease. So this is a key part of what I want to do today. I'm talking to educators. So I want to take us back memory lane. Now we know what the virus does. We understand for the most part what COVID does to the body, but this is what drives our decision. This is what is driving mandates. This is what is driving public health measures. So I just wanted to touch base and talk about it a little bit. So if you look at this picture, this is a magnified electron microscopic picture of the COVID virus. And basically it's just a genetic material, also known as the RNA, an envelope covering the virus. And what we all have been talking about, you hear it a lot in the news, are spikes that project out of the membrane, otherwise known as the spike protein. Now, this spike protein is important in everything. Without this spike protein, the virus cannot attach to and enter the cells. And spike protein is what we target in vaccine development and in prevention. So when you get exposed to COVID, meaning that you are exposed to somebody with COVID infection, the virus gets deposited in your airways. And then what happens is that the virus attaches to the host cell, to the human cell, through the aid of the ACE2 receptor. Now, the ACE2 is vital. We all have it, and it's supposed to be protective because it helps in both cardiac health and vessel health. It's a very, very important protein and enzyme in our system. But this virus does what a lot of other viruses do, uses something that you already have to cause infection and transmission. So the spike protein attaches to the ACE2 receptors and then is taken into the cell. It sheds its genetic material and it uses our bodies. It uses a host cell to kind of create more viruses, such that one or little bit of virus can create hundreds and hundreds of viruses. Now, the body doesn't just sit back and do nothing. There is a well-coordinated response in the ideal situation. And with COVID, we've come to find that many situations are not ideal because the virus is very intelligent in the way it interacts with the immune system to cause some kind of dysregulation. So the immune system is made up of the antibodies. This is the first thing that comes to neutralize the virus. And for children, they don't have a lot of ACE2 receptors. And because they are used to tackling colds and snorts and other viruses, they tend to mount an immune system more readily, than adults. But that has changed with various variants. So your body mounts an immune system, antibody to neutralize and kill the virus. But many times, the antibodies may be overwhelmed in such a way that the viral multiplication continues. And then your body's other defense system is an array of defense system, also called the T cells, will be able to contain, the virus even though you are infected. And this is the ideal situation. But unfortunately, with about 800,000 deaths, we know that for many, many people around us is not ideal. So for some vulnerable people, and even in some cases, healthy people, what happened is that this virus interacts with the body in a way that it causes changes in the immune system, such that the virus causes a lot of effects in the lung, the kidneys, the heart, because they all have ACE receptors. And also the immune system, the dysregulated immune system, leads to what we call bystander effect, which means leads to additional damage of these systems. Why am I saying this? Because prevention works. We know how the virus works, so we know what to do with prevention. The first level of prevention is don't expose yourself to the virus. So masking, physical distancing, avoiding crowds is a way to control your exposure such that you don't get infected. But even sometimes you get infected, perhaps you are infected with such a small dose that you are able to contain the virus. So mask, physical distancing, avoiding crowds would always work. And in an ideal world, I know now we have a lot of people now, not wanting to put on their mask and stuff, but it works. Very protective. It is great. And also I get a lot of questions from teachers talking about the children, don't like wearing their mask, like putting on their mask. But we have been many months, almost going to a year 2 of this pandemic, that one thing we have done very well as teachers, as physicians, as parents, is to teach children, to put on their mask consistently. Another question I get about masking is, okay, what kind of mask? As far as children are concerned, as long as they can wear the mask, is okay. You can use any kind of mask that the child will put on. Other questions are that, some children can't tolerate a certain kind of mask. I would say like cotton mask that is a little bit more breathable for using children would really work. So masks, work to prevent infections. They work as long as you use them consistently. Physical distancing, good ventilation in the area so that whatever droplets and particles is in the room is sent out into the open air. This works to prevent exposure. But unfortunately, we can't always we can't always predict the behavior of other people. So we will be exposed. So what happens when you are exposed? So this is where vaccine play a big role. So what vaccine does is that it takes this spike protein without the genetic material, simulate exactly what will happen if you are exposed to the virus, and then stimulates a vigorous immune response to the virus. So the vaccine is kind of creating the ideal and controlling for many variations of response to the virus, because we do know that the way the virus interacts with the immune system could be very dangerous for some people. And even for those who have had the infections before, we also do know you do not want a second impact. So yes, you've had the COVID infection before, you may have been asymptomatic, it may be mild, but the vaccine is still very safe, effective, and gives you that protection that you need. So the vaccine also does the same thing. It mobilizes neutralizing antibodies so that when you are exposed, it neutralizes, it kills the virus right away. And in addition, it also mobilizes those T cells I talked about, those memory T cells that are right there, but peradventure that antibodies are overwhelmed can come into play to contain disease. So this is why people who are vaccinated are less likely, to have a severe disease. They are generally less likely to have infections at all. But those who end up having infections, they have a coordinated system of response to handle the infections. So what about children? Now, I had pointed this out that children do not have a lot of ACE2, adults do, and especially those people with chronic diseases. ACE2 is supposed to be protective after all. So we used to think they are less susceptible, and we used to think, okay, they mount antibody response very well, but then came Delta. What Delta did was to create a lot of mutations, just made a lot of changes. So mutations, this virus has been mutating right from the beginning. Because when the virus enters the host cells, it then goes through all these steps that copies and assembles the virus. And during the assembly process, there's a lot of errors, and these are what we know as mutations. But if these mutations are cumulative and significant enough to create a change in the binding site, then it becomes very important, because if the virus binds much more tightly and is able to trick the immune system such that it doesn't recognize that spike protein and reacts to it, then it means that we have a variant of interest or a variant of concern. This is why public health officials watch for them so that we can quickly respond to them. Now, to date, there has not been any variant at all that has been able to completely evade the vaccine. This is why we tell people, get your vaccine. And if you are 6 months out, which means perhaps the level of neutralizing antibodies are beginning to decline, get the booster. it still works. I think our focus, I know we are all talking about the Omicron, what it's going to do. Is it going to invade the vaccine? Is it going to invade the antibody we give? Is it going to make us more sick? But our key focus should be on getting people to get their vaccines and get their booster. And in addition, continue that extra layer of protection like masks, physical distancing, avoiding crowds and stuff like that. So we are seeing Delta. We saw that Delta affected a lot of kids, landed kids in the hospital. A lot of kids had a lot of cardiac effects. Multi-inflammatory syndrome of children is a disease, is a disease that is caused by COVID, kind of due to like what I showed, a dysregulated immune response, and can also significantly affect the heart. So I saw a lot of children with abnormal, heart function, abnormal, lab tests. So this is why we must protect children against COVID by vaccinating, by vaccinating ourselves, for those who can't receive the vaccination, and by encouraging that all children 5 and above should get that extra protection that they need. And because children are still growing, all their systems are still growing, we really don't know what the long-term effects of all these cardiac and other abnormalities that the actual virus has caused is going to mean for them in the future. So as a pediatrician, I'm very passionate about it. I talk to parents about it, and I am really grateful that I have been able to really talk to parents about why we do what we do, talk to people about why we do what we do, and they said, okay, yes, it makes sense. I need that extra layer of protection. Additionally, for children, they are more likely to have mild disease, even though many of them get sick, but their transmission risk is very high. Younger children can transmit the infection just like anyone else, and they may end up transmitting COVID to vulnerable, caregivers who then succumb to the effect of the disease. This is why it's very, very important. I already talked about the presentation and the coupon effect. I would like to add that I am beginning to see an uptick of COVID in children, not just COVID. We are seeing a lot of respiratory viruses. Everything we've talked about, especially the barrier method, the masking, the social distancing, and all the measures will prevent all these other diseases, in addition to hand washing all the time and teaching children, to wash their hands. So we have the Pfizer vaccine is recommended for everyone can take the vaccine, 5 years old and above. There are 2 doses given as a primary series, but for those who have weakened immune system, for certain group of people, based on your conversation with your doctor, your primary series actually is 3 doses, not 2. So the Moderna and J&J is for 18 years and above. And for those who have had their last dose 6 months or more, should get a booster to get that, additional protection. So a quick word on isolation and testing. Now, for children, anyone that tests positive for COVID should be isolated for 10 days from either the onset of symptom or the positive PCR test. Everyone, whether you are vaccinated or not, you need to isolate yourself from the community. But for quarantine, which means if you are exposed, it's kind of different. And I'm going to defer to the Board of to the Board of Health to talk about what they actually require. For quarantine, for those who are vaccinated, which will be children over 5, I believe that they can safely, monitor. And as long as there are good monitoring and testing in place, they can safely go to school. But again, I'm going to defer this to the next speaker. When you are exposed, it is always a good idea to test yourself to know if you are infected, because if you're infected, then you have to isolate. And doing the test very early does not make any sense, because it takes time for the virus to multiply enough to be detected by the test. People ask me, should I do antigen or PCR? Antigen detects the protein in the virus, while the PCR detects the genetic material, is the gold standard. but it depends, and maybe I'll wait for the question and answer session. If you're going to have a lot of family over, and this is a lot of question I get, I don't feel comfortable, a lot of them are not, vaccinated, what do I do? You could get a home-based test and just say, okay, let's test each other. Let's make sure that, we are all gathering in a safe manner. I think is really that extra layer that is good, because you never know who is going to be that vulnerable person. And I've heard just a lot of heartbreaking stories. Everyone was fine, but grandma succumbed. Everyone was okay, but grandma succumbed to the illness. So you never know. So putting that extra layer is great. So I'm going to close with just a few remarks. When COVID hit, I was thankfully part of my hospital COVID response, and I got exposed to this remarkable doctor, very awesome. I call him my big brother. I have a lot of respect for him, but he ended up in the ICU for 3 months. And it took several months after that for him to go through rehab to come back to normal functioning. I think what moved me the most was that when that vaccine came out, he was first on the line to get the shot. I thought that was so awesome. Well, based on what I saw during COVID, I was also first online to get the shot. It's easy to argue and come up with these theories, but once you have seen and you have experienced and people, it kind of gives you another level of perspective that you need to protect yourself, and you need to talk to people about protecting themselves. My 2 children, one worked in the ICU taking care of COVID patients. The other one also works in healthcare. She works in pharmacy. So you had a home or a family with all, healthcare workers. So I think I was one of those people that said, God, please give us a vaccine. And I'm so grateful that we'll have a vaccine that is safe and effective. Now, there are still a lot of unknowns, especially with the new variant. But one thing I know is that when you get your COVID vaccination, you get your booster, you are protected. You have some level of protection. And don't forget the other measures that we talked about. So I know this talk is targeted towards COVID, but we are beginning to see an uptick of flu. And in children, we are seeing a lot of respiratory viruses. So prevention for children is key. And all children 6 months of age and older can get the flu vaccine. And for those 5 years or more, they can get both the COVID and the flu vaccine on the same day. And I would like to close by saying, since I'm a doctor, I would like to just give this message to those people. If you know that you are at high risk. Now, what is high risk? That, your BMI is high, which means you're overweight. You have some chronic illnesses, you are taking medicine that affect your immune system. Talk to your doctor about monoclonal antibody if you get COVID. It helps to reduce your risk. Please try to take it. And finally, on a more lighter note, I would like to close on a light note. If you are like me, a lot of us during COVID, we've put on those COVID pounds. So I just want to encourage everyone, part of immune response and any kind of response is overall health. Get active, get out, layer up, and just get active and focus on your health, focus on wellness, focus on soul health, mind health, body health, and everything, just to make to ensure that you are in good, vibrant health, to be able to tackle not just this virus, but everything that comes at you. Thank you very much.
Thank you, Dr. Kess. We're going to move forward with Dr. Rivera Nunez.
Thank you for the invitation. Very pleased to be here. I just want to start by telling you a little bit about me, so you know who's talking to you today. As I am an assistant professor of epidemiology at Rutgers School of Public Health, and my main research interest is maternal and child health and prenatal exposures. So I basically study, different exposures that moms they have during pregnancy and how that may have an impact on their pregnancy and the child after delivery. However, in the last year, I have been part of a really large team of researchers at Rutgers under the project NJ Heroes 2, which stands for New Jersey Healthcare Essential Workers Outreach in Education Study. And we focused on Black and Latinx communities disproportionately affected by COVID-19 in different places where Rutgers is deeply rooted through the state. We basically designed a study with community members to learn more about testing during the pandemic and what are the patterns. And now we are studying, we are moving to study vaccination patterns and what are the, where are the gaps where the population is not getting vaccinated, why is that, and how can we intervene to increase the vaccination proportions of the population. I'm also a mom. I'm a mom of 2 boys. Now they are 5 and 8. But back in March 2020, when we started all of this, my youngest was 3 and he was sent home while me and my husband, we both had to keep our jobs and, the expectation of a full day job with 2 kids at home. It was very difficult. And I have no words of appreciation for all of the workers in early and childhood education. Actually, last year, my youngest, who now it's 5, but it was 4, he was in pre-K. He was the only member of our family that was able to have a little bit of a normal life. He went to school every day while his big brother was at home. And I have no words of appreciation for all the work that all of you do. I'm an epidemiologist and I'm gonna show you a little bit of data. So these are the cases, COVID cases through the pandemic. This is April 2020 when we have the first peak and the first wave. And this is by age group, right? 0 to 4, 5 to 11, so forth till 75. And you can see that through time, the different groups, age groups that were more affected early on, we have the 75 plus here. Most cases came from that population. And you can see as we move forward, different peaks and different age groups started to be affected. This is 18 to 29, which peaked last winter. And again, later in April. And now today, here's where we are, the last pieces of data. Here in the arrows, it's the population that you serve, right? The 0 to 4, which remains most of the time through the pandemic, remains as the population with the lowest risk. However, we started to see some peaks in the last month, as Dr. Kest said during her talk. Okay, so this is some data. The data that is telling us that the CDC guidelines that they put for early child and for all the centers and different programs works. We have data suggesting that this is a quote, under the right conditions, centers-based care is an unlikely COVID-19 threat to staff. And center-based care is referring to daycare centers, for example, preschools, early childhood education centers. Implementing and monitoring adherence to the recommended mitigation strategies that Dr. Kest just talked about masking, vaccination, washing hands, etc., reduces the risk of COVID-19 transmission in childcare settings. And this is by a couple of studies from the CDC. And this other study came up this year. Exposure to childcare was not associated with elevated odds of COVID-19 among childcare workers. A caveat to this is that we always have to pay attention to community transmission. So if you live in an area where the community transmission is really high, you should keep all your precautions up high. And all this are upon, the main thing is everyone has to keep all the infection mitigation efforts. In every place where all the mitigation efforts are up to date and are followed, we can see that there's no peaks and outbreaks are controlled. And so what are those guidelines that the CDC, and some of you or most of you probably know all this. I'm just going to reiterate a few things now in the updated guidelines that came up in November 10th of 2021. First one, universal indoor masking. That remains the same for everyone ages 2 and older, regardless of their vaccination status. Then in this version, they come up with a screening testing information as prevention, and this is mostly for unvaccinated individuals. However, they have a specific recommendation that applies to fully vaccinated people, and it says fully vaccinated people who have a known exposure to someone with suspected or confirmed COVID-19 case to be tested 5 to 6 days after exposure. And this is a little bit of what Dr. Kess mentioned before, regardless of whether they have symptoms, right? So this is mostly because of the breakout through infections. If there's a fully vaccinated person that had contact, that person still should be tested 5 to 6 days after that exposure. Then the prevention strategies remain critical, starting with vaccines, masking, and hand washing. And they kept a bunch of other recommendations that were done early on in the pandemic, like playing outdoors and limiting the number of children in a room. But we know that each state have modified some of those. Now, for example, it's winter time, it's much harder to have the kids being outside or play outside. And again, the different localities, so depending on where you live, they should monitor community transmission, the vaccination coverage, and the occurrence of outbreaks. So if any of these are very high, like community transmission, or very low, like vaccination coverage, those are red flags for the centers to monitor and adjust according to that. Particularly, this is very important in underserved population. Like Dr. Kess mentioned, people of color, we have been affected the most in this pandemic. And before we go to your questions, I just want to make the point that the community engagement is critical, right? But then we all come from different aspects of life. Different communities can have different starting points, different needs, trusted sources of information. And as I prepare myself to talk to each of you, I need to have that in mind. And then as you prepare yourself to talk to your employers or to talk to the parents that you work every day with, you have contact with, that's another thing that we need to take in consideration. I think sometimes we rush through what we think, and we don't take the time to think how I'm gonna say this, or what would be the best way to talk to somebody, and not convince them, but just provide with facts that you think they're going to help them to make decisions that we want them to make for the health of everyone that is around us, and for the health of the community. And with that, I'm just gonna stop sharing my screen, and we will take any of your questions.
Okay, I'm going to ask all of our panelists to come on screen at this time so you can respond to questions. We have a question in the chat box. Is there any data on people who are fully vaccinated and after receiving the booster still contracted COVID?
Oh yes, thank you. Yeah. whenever anyone who is fully vaccinated gets COVID and we know of it, is reportable. We do report it, is being monitored. And this is how we come up with all these numbers and statistics, that if you are vaccinated, you are much, much less likely to get the infection. And even if you have infection, most cases are mild and rarely lead to hospitalization and death. It is monitored in real time, not perfect, but we do have data.
Okay, thank you. So we've grouped the questions into certain categories. And again, thank you to everyone who sent in questions. I think we have about 30, and I'm hoping that we'll get to all of them, but we'll try our best. So the first question is a staff and employee question. Are employees who are vaccinated required to be tested weekly?
No, they are not.
Okay.
That was a simple one to start with. Thank you.
However, Brian, if an employer wants to require that, do they have the authority to do so?
Absolutely, and that will depend on. In some cases, we do have issues that are specific to an individual employer. They may have collective bargaining agreements and other things that may stand in the way there. But generally speaking, an employer is within the right to ask that. We don't recommend that, but it is definitely within the purview of the individual center to require it if they think it's necessary.
Okay. And can vaccinated staff in the center go without mask?
Unfortunately, at this time, they cannot. The governor's executive order was pretty clear on that. Both children and staff over age 2 are required to be wearing those masks at all times at this point, except when eating and sleeping, and a few other exceptions.
And I would like to say that we actually had real time data during COVID when everyone, especially in areas that were masking, it was just amazing what mask could do. We had less RSV, less of all these viruses. In many areas, children's hospitals were actually almost shut, and we ended up catering for older people. But then came Delta and things changed. So it does work, and this is why it's something we should embrace, because we are fighting. We're in a war. We are fighting the fight against COVID. And the earlier we win this war, the earlier everyone can return back to normal. So yes, it is a temporary inconvenience. It's not easy by any means, but this is something, a little sacrifice that we can make compared to the big picture.
Okay, thank you. Is it mandatory for the staff to get the flu shot?
It is not. So we have, the COVID vaccine for testing is mandatory, and then we require tuberculosis test, but otherwise there are very few actual hard requirements for staff. So the flu shot is not one of those.
If you don't mind me adding, I would like to encourage, even though it's not mandated, I would like to encourage everyone to get it, because this year we are looking at flu and COVID, not a very good combination. So do get it for that extra layer of protection.
Okay. Are infant room attendants still required to wear gloves when bottle feeding?
So no, they're not at this point. We do expect hygiene practices to be adhered to, and we would encourage everybody to be very careful, but that is not explicitly required if they prefer to do it another way.
Okay. So I just like to add, and sometimes people don't realize this, that the licensing requirements are minimal. And so if there's a need to add an extra layer, and correct me if I'm wrong, Brian, it's okay to add the extra layer if your director says we want you to wear gloves.
No, absolutely. And we have tried. We know that a lot of you in the provider community have gotten some pushback from parents when you do that. But we're willing to back you up on that every step of the way. And we know a lot of centers, even when the requirements, over the course of the last summer were a little more minimal, we were kind of in the downswing in COVID. A lot of our stricter requirements were relaxed, but even through that period, a lot of centers, I think very wisely, did keep a lot of these more stringent requirements in place. And I think a lot of them definitely, if you ask, will tell you that they benefit from that for a lot of the reasons that that others have brought up. But everybody's healthier, everybody is more able to continue to attend. You have a lot fewer problems, and you know your population, you know who's attending, you know what is appropriate for your center, and we would encourage you to definitely do what you think is right.
And don't forget, even whether you wear gloves or not, don't forget taking out your gloves and washing your hands before you touch your face or do anything else. Hand washing, like Brian mentioned, is the single most important tool in prevention when you're bottle feeding or any other contact measures with children.
Okay. Can we ask parents to get their children tested weekly?
Yes,
I mean,
there are 5 doctors up here. We don't talk about regulation. Yes, and again, that gets back to the same answer. Where centers want to exceed and be more careful about some of these requirements, they are definitely able to do so. Outside of some very specific situations that you might find yourself in particular programs, but as a general rule, you can always exceed what we're asking, and that's definitely something you can do. I'll defer to the medical folks to say whether that's something that they would encourage given our capacity.
I honestly believe, I believe in testing, and testing is one of the ways we can kind of control the epidemic, because if we test and we know you're infected, we could kind of isolate the person, all right? However, we should also think about who's going to pay for the test, the cost of testing. I talk to different parents from different backgrounds. I have parents who tell me, oh, I have to test my kids and myself every week. That works for them, great. But if you are exposed, definitely test. If you have symptoms, definitely test. If your school district requires, definitely test. There are certain districts in New York that use testing as a tool, but they pay for it. So telling a parent to shell out an extra $25 a week, for testing might be too much, for that parent. But close monitoring in terms of exposure, symptoms, all the mitigation measures that Dr. Nunez talked about, they still work. And of course, getting yourself protected by getting the vaccine.
Okay. Children who suffer with asthma struggle with masks during the day. Do you have any suggestions?
Yes. I think what I have done with parents is that sometimes just changing the type of the mask to a material that is more breathable and easier, because what we are trying to prevent is that droplet, either on the child or the child, putting that droplets on other children. Works for most of the cases. Now, there are going to be selective cases where no matter what you do, the child is unable to tolerate the mask. You could reach out to the provider, the primary care doctor, and they could definitely give that child an exemption. But it is an exception rather than the rule.
Okay. Are other common childhood illnesses like HFM and RSV more present this year than in the past? And how do we minimize spread?
I believe I already tackled some of that, but we are really, really swamped by a lot of respiratory viruses. They have made the big comeback. And we know why, because we understand the science behind what is going on. Because people are a little bit more comfortable not wearing masks, going to crowded places. So the exposure to not only COVID, but other viruses right now is high, for children. So yes, we are seeing a lot of respiratory viruses, and it's sad to say we are also seeing children very sick that they need respiratory support from respiratory viruses. We're having a very busy year for respiratory viruses, and I'm glad that we have the opportunity for this talk, that the small sacrifices we have to make. I apologize for calling it small, but in the bigger scale of things, masking, hand washing, social distancing, on a consistent basis, they help stop And of course, good ventilation, like Dr. Nunez has mentioned, and keeping numbers small in a specific class. They help like really, really mitigate the spread of all of the viruses.
This person wants clarification on the various quarantine times when the unvaccinated child is either exposed to or confirmed positive.
I'll defer to Dr. Nunez, please.
Yes, so right now we will continue. I was actually answering a question like this in the chat. We will continue doing quarantines while these kids are not vaccinated, because none of the population that most of you served can be vaccinated at this time. So while that it stays like that, quarantines will still be the case, and I don't see that being different in the near future. So if a kid has any symptoms, he or she will be sent home, and it has to be tested. If the test comes positive, then it's 14 days. That's the quarantine. And everyone else in the classroom will have to do the 14 days. And so my understanding, the rooms on the daycare centers, they are different, they're different by numbers. Like the infant room has less kids and the other rooms have more kids. So that's dependent, and they all are together. So we will have to follow that. And I don't see that changing anytime sooner. I don't know if Brian has another.
No, I would just like to add, and this is sort of a theme that is emerging here too. We did, in conjunction with the order that stipulated the vaccine and masking requirements a couple months ago, DCF did lift some of the restrictions that had previously been placed on the grouping of children, because we had heard from a lot of families, from a lot of centers that was causing problems, that staff was just not available, and the center capacity was reduced pretty significantly if groups couldn't be a little bit more liberally mixed. And so we really took off a lot of those restrictions, but I would say, again, as we've been saying a lot this afternoon, you're not obligated at that point to forego those safeguards. You definitely should, and I would highly recommend that you be very conscious of the population you're dealing with and try to avoid mixing groups as much as you possibly can. And obviously every center is different, the circumstances are different, the population you're dealing with is different, but you want to make sure you're being as careful as you possibly can to minimize the contact that each child has with other children within the center, because as Dr. Nunez said, when you have one child test positive, that will impact the whole room. And they will all be on quarantine, and you want to make sure that as much as possible that child has contact with as few other kids, as few staff members as they possibly can, or you're gonna be shutting down the whole center at some point. So we're really working on faith here and hoping everybody does what they need to do to be careful within their own center, but really definitely want to encourage that.
Yeah, and as we move forward in school age kids, now when a kid shows up with symptoms, they're sent home, and what they call close contacts, so the kids that sit around that child that has symptoms, they are also sent home, but not the entire classroom, okay? If now that we're starting vaccination of 5 years and older, if these kids that are close contact to the kids that is showing symptoms, if those kids are fully vaccinated, that kid will not have to be quarantined and he can stay at home. That's the policy right now. So moving forward, as we vaccinate more children, the quarantine overall and the quarantine periods are going to be less or modified. But right now, for the population that you serve, I don't think it's just exactly how Brian said.
I'm going to take a question from the Q&A box here. Are childcare centers now allowed to use sensory tables and do cooking projects, or is it still prohibited? Also, are we advised to have holiday parties with parents?
So the sensory tables and the cooking projects, yes, we've definitely backed away from some of the earliest restrictions that were very, and I think again, there's more of a science question, but I know the emphasis at the very beginning of the pandemic was both on that personal contact and transmission through surfaces. And I think the science has really moved us in a different direction on that. So we really haven't had those restrictions on sensory tables or the sharing of materials, with the obvious caveat that, you know, we want to make sure those hygiene practices are observed, that everything is as clean as it can possibly be, just for, you know, all health purposes. As far as holiday parties, you know, we're definitely not encouraging large parties by any means, and I think that's a running theme throughout everything. But visitors are permitted, provided they are screened. We would definitely encourage you to adhere to masking requirements and social distancing as much as possible. Do everything outdoors if you possibly can. I won't go so as far as say we're discouraging holiday parties, but we're definitely aware of the potential risks there. And you know, for the most part, those after hours type events are things that are outside of our jurisdiction. Those are essentially social gatherings that are happening in a building that's also used for childcare as opposed to a childcare event. But you know, common sense, abiding by the precautions that are advised by the CDC and our health colleagues, and, you know, definitely think twice and be very careful if you do it.
Okay, so we have a question. The PowerPoint for today's presentation will be emailed to all participants, and it will also be posted on Programs for Parents website when it's been edited and whatever else we have to do. Okay, we're going to move right along with the questions. Appropriate steps. What are the appropriate steps to take when a parent or a teacher tests positive? Are they the same as if a child tests positive? Dr. Kess, do you?
I was just deferring to my Board of Health colleague. Okay, yeah, yes, definitely. A child that is exposed to COVID should stay home and not come in to daycare or school, because that's is an intimate, close exposure. So that child should be quarantined for 14 days, unfortunately. But I would also advocate that we layer up by even testing the child. Like I said, maybe day 5 to 7, such that if the child tests positive, you know that you are moving from quarantine to isolation. All right. So yes, definitely not come. When a teacher tests positive, I'll defer to Dr. Nunez. If it depends on whether the students are vaccinated or not, but you guys mostly cater to unvaccinated children, less than 5, right? So yeah. I believe definitely the entire class is going to be placed on quarantine. So Dr. Nunez, you can add to that. What are your policies?
Yeah, that's exactly what is happening because they're not vaccinated. If a parent tests positive, the expectation is that parent tell the center that they have tested positive.
It doesn't always happen.
Yeah, exactly. So unfortunately, that not always happen, right? Yeah. And when that does not happen, if the child, it's also a positive case, that's when we have a spread and an outbreak that we don't know early enough to restrain that spread. And because many children show no symptoms of the disease, we will wait till that child that shows, visible symptoms. And by then, it may be very late, right? It may be like we have 3 or 4 kids sick, and one of those kids that is sick will take it home to their elderly grandparent or their siblings that is immunocompromised. And that is the problem, and that's what we're trying to avoid. Even if I see one of in the chat, even vaccinated people or unvaccinated people, they can get COVID and they can transmit COVID. What we're trying to do here is to limit the mortality of the virus, right? How many people get how many people die because of this, or how many people get hospitalized because of COVID that overcrowds our system. And what we saw early on in the pandemic and what we have seen in different peaks through the pandemic in different states and different geographical areas here and in other countries. Yes, the vaccines will reduce the probability of you getting COVID tremendously, right? But you still have some chance. Yes, that is true. But we still want you to restrain yourself from others, to quarantine, because maybe you don't have symptoms because you are vaccinated, but that child that is immunocompromised, or that grandparents that it's just, you know, in their 70s, the risk of dying or the risk of getting hospitalized is, it multiplies. If you compare it with a child that maybe have just mild symptoms, or the vaccinated person that just may show mild symptoms. And before I end this conversation here, also one thing that we don't know, because we have not been in this for a long time, it's what we call the long COVID. Even people that have mild cases of COVID later on, they have lingering health issues that we don't want that to happen, right? We don't want a healthy 30-year-old that eventually have cardiac disease or other diseases just because they had an infection that could be prevented, and they may be, you know, disabled or incurred in a tremendous stress in medical bills because that. So I understand why, if I'm vaccinated, why I have to, quarantine, why people that are vaccinated are also getting infected. All that is true. But our goal here needs to be decrease the number of people that die because of the disease. Maybe you don't die because you were vaccinated, or because you're healthy, or you're one of the 90% of people that get just a mild infection. But other people will crowd the ER, the hospitals, or the whole system, and they may die. So that should be our goal in using all the prevention strategies that we have talked today.
That's very, very well said. I get engaged by a lot of people, family members, patients that are saying, okay, why this, why that? And I also like to say, in everything we do, we punch numbers for probability and statistics. Everything. That's why, as a doctor, I can tell people, hey, listen, if you get a common cold virus, you are less likely to die, you'll be fine. But unfortunately, for some people with weakened immune system, it may just be the beginning of a very bad infection and even hospitalization or death. So it's the same thing we are doing with punching numbers. You are less likely to get the infection, rarely you may get, but we are protecting the population, especially those people who, I would also like to know, there are people who were otherwise healthy with no medical history, nothing, that ended up succumbing to this virus. We are fighting a war, and this is a sacrifice we all have to make. You are less likely to get the infection, you are less likely to be hospitalized, you are less likely to succumb to the virus, but also my responsibility, your responsibility, is to use these mitigation measures to reduce the likelihood of someone else, you know, getting this disease and getting really sick from it.
So thank you, Dr. Kess, because the question that I was going to ask is, how can you dispel misconceptions about vaccine? And I think you've given us a very good response by saying it's going to reduce the amount of death, sickness, emergency room visits, and keep people healthy in general.
Yes.
Okay, this is a question that I think I can take. During COVID, and for safety reasons, of course, the Division of Family Development postponed or discontinued families having to swipe in for attendance. So you're not using your Family First card to check in and check out. And the question is, what's going to happen with that? Is that going to continue? And the response is, and I encourage our DFD colleagues who are on the call, if you want to chime in as well, there's not been a final decision on when that will end or what will happen. And so as soon as a decision is made, we will certainly let you know. And if anyone from DFD is on the call and you have something else to add, please put it in the Q&A and we'll share that as well. Okay, let's see here. So we have a lot of concern about moms and dads testing positive for COVID. And I think it's already been stated that first, we hope that mom and dad is going to report it to the child care center so you know that they have tested positive for COVID.
And Beverly, I just want to say, from the parents' perspective, I understand. Because I work with parents a lot. You don't want your child to spend one extra day at home. And the reason for education is that it has its benefits. Your child has social interaction, it helps with growth and development. There are so many benefits, and this is why you guys do an amazing job. But we are in a public health crisis mode, and we all have to do our part to make sure that we get this season fully behind us. And the more we all do our part and cooperate, the faster we can get this, to move behind us. Unfortunately, you're going to have a lot of people who do not want to do what they are supposed to do. But we are not talking about those people. We are talking about you. We are talking about me. What we need to do to fight this fight.
So one of the research institutes at Rutgers actually did a study that said that about 23% of parents with children 0 to 3 have not brought their children back to childcare. So the question here is, what are some things we can say to parents to help them with their concerns over COVID in childcare? Because we do want parents to bring their children back.
I think Dr. Nunez is going to give the more robust answer, but I would like to say that I think if you just hear everything we have been saying, I think we are sending that message that, hey, we are doing everything we can to create that safe environment for your child. So you can go ahead and count on the fact that there are preventive measures in place, there are mandates in place, there are oversights in place, there are all these measures in place to ensure that your child, studies in a safe environment. And like Dr. Nunez mentioned, she actually talked about community transmission risk, that the risk for the child getting COVID from the community is now actually greater than getting COVID in the daycare. So I think that is a strong message, to parents, caregivers, and everyone, that the state, everyone is doing what they can to ensure that your child not only comes into a safe environment, but can fully benefit from the safe environment in learning, growth, and development. Dr. Nunez?
That was great. I will only add that we can have the facts, right? And just craft an answer or a message for parents. There's more and more data just saying exactly what Dr. Katz said. Your child is safer inside the center than outside, particularly in communities with high levels of COVID. And there's more and more data on that direction. And when vaccines comes for, now that they are there for the younger kids, 5 to 11, that protection is going to be even larger, right? Because the 0 to 4-year-olds cannot be vaccinated yet, but now their siblings are vaccinated. Now their parents are vaccinated. So they are going to be even more protected. And I think that should be the message, like being honest and show the facts and show them everything that you're doing in each of your centers and how the data shows that those are effective. And that's why we don't have any large outbreak in the state. We don't have, and not only in New Jersey, this is something that is across the nation. And that message should be, concise and repetitive. So little by little, parents will be going back to the centers.
Okay. Ideally, childcare directors want their entire staff to be 100% vaccinated. But I know Brian said earlier that there are some. So the question is, how do you convince your staff? And I think we've alluded to it in the past. How do you convince your staff that this is the thing that they really should do, given all the misconceptions and rumors and myths that are already out there?
I think one thing I've seen is that you have to understand why the person is refusing. I think investing in hearing the person out, there are different reasons people refuse. Some people are afraid of side effects, and educate them that, it's a safe vaccine, very effective. Side effects are very, very rare. Okay, but most of the side effects is fever, pain, on the side, which typically will resolve in 24 to 48 hours. But the benefit is that your body gets to mount this coordinated immune response. Peradventure, you are exposed. And vaccine has been shown to work, over and over again. We have data. Now we've given how many million doses worldwide, maybe billions, not millions. So there's data to show that it's working, something's happening. Now, I do have this occasional person say, I am scared that maybe they're going to be that one person who's going to have like that severe, side effect and even maybe, So to that person, I would like to say, I do understand your fears. They are valid, but there are things you can do. How about sitting with your doctor and developing an action plan? Okay, I will try to get my vaccine at a specific place where they can respond fast if I get a side effect. Now, instead of just dismissing and saying, oh, you don't know what you're saying, but you really have to, address that fear, have an action plan. I will do X, Y, Z. I'll go to a specific center where they can respond fast. And we know so much about even the very rare side effects now that we also know how to handle and manage them. So have the action plan. If X happens, I'll do this. If Y happens, I'll do this. Have that plan of action with your doctor, and probably that would help, the resistance to the vaccine. Now, I did have a 24-year-old. The parents called me hysterical because he felt that if he gets the vaccine, he was going to be kind of some zombie apocalypse. Or, these questions happen. I just try not to downplay them, but to kind of show understanding. And fortunately, I'm also married to a pastor who is a missionary. So I am blessed to be able to help people who are struggling with some kind of religious views and point them back to say, no, this is a blessing. This is good for you. Take it, get that extra protection and protect your community.
Thank you. What, if any, are the proper steps for a child that has traveled out of the state for the holidays or longer and has returned? Should we be doing something with this child? There's no sign, it doesn't appear that there's a sign that the child's been infected or anything like that. They've just gone out of state.
So I can say we're not enforcing anything related to out-of-state travel. We're seeing some information that the CDC in the Q&A may be providing guidance contrary to that somewhere. I'm not familiar with anything contrary to that. There may be some old guidance on the CDC website, and you may want to.
For some time there was,
yeah,
but not anymore. That has, mostly disappeared. But international travel, that year, like because of the Omicron variant, I would like to know if you and your child just returned to certain parts in Southern Africa that President Biden has kind of put restrictions on travelers. So it will be nice to have the information so that there will be an appropriate response. But I think apart from that, really nothing.
Well, I think we've covered most of our questions. Some of them were actually covered during the presentation. So at this point, if there are no additional questions in our Q&A box, I think you guys have done a great job. You've been so informative. I think you've answered all of our questions and added some extra information that we can take back to the centers and maybe share with staff members and parents. So I want to thank all of you, Brian Ross, Dr. Kess, Dr. Nunez, for participating today. You've been great. You are so appreciated. I know this call is well overdue. Centers have been calling with questions for a while now. And think your answers responded to all of those questions. Let's just see here. There's one more in the queue. Okay, I think that's just a thank you. Thank you so much. And we really appreciate you and thank you for spending time with us today.
Thank you.
And for our listeners, our participants, we will again send this information out to you. I hope this has been useful to everyone that presented, listened and presented. And the final word says, thank you. This has been an awesome presentation. And then lastly, I want to thank our partners, certainly our partners at the Division of Family Development, because they helped to initiate this. The Child Care Health Consultants at Central Jersey Family Health Consortium is available if you have additional questions. You know, we partnered with Maternal and Child Health, and they are also available and ready to help, along with the Greater Newark Healthcare Coalition. And when we send out the PowerPoint, we will send you contact information for our partners as well. Thank you so much and have a good day.
Thank you, everyone.
Thanks.